Congratulations on your twin pregnancy and welcome to week 12. Today I'm going to talk about what's going on with your tiny human, normal signs and symptoms for you, what to expect at your upcoming OB visit, and things you can do to maintain a healthy pregnancy. At this point, your little ones are measuring just over 2 inches, roughly 5.5 centimeters, from the top of their head to the bottom of their tailbone, and weighing in just over 2 ounces or 58 grams. Your babies are very active inside of your uterus, stretching and kicking. This week, their facial features are forming, their organs are developing, and their genitals are being formed. However, it is still a little too early to see those on ultrasound just yet. As far as you're concerned, because you are carrying twins, your symptoms can be a lot more intense. You can have nausea with or without vomiting, food cravings, food aversions. You may feel dizzy, you may feel lightheaded. I am sure you feel exhausted. You may have more headaches than you usually do. You probably are seeing more vaginal discharge. It's very normal for you to have some cramps, twinges, a lot of round ligament pain, those stretching pains every time you make a sudden movement. What's not okay is bright red bleeding that's enough to saturate a pad, cramping that won't go away, severe pain of any kind that is persistent. So do you have an upcoming OB visit? At that visit, they're going to want to get your weight. Recommended weight gain in a twin pregnancy is somewhere in the neighborhood of 37 to 54 pounds, depending on what your pre-pregnancy weight was. They're probably going to do an ultrasound, measure those babies' heart rates. Normal heart rate at this point is 120 to 160 beats per minute. They're also going to want to see what's going on with your babies. Are each of them in their own gestational sac with their own placenta? Are they in their own gestational sac sharing a placenta? Or are they the most rare, sharing a placenta as well as a gestational sac? Your provider's probably going to want to talk to you about different genetic testing options. They may order an early glucose tolerance test. Because you are carrying twins, you are at increased risk to develop gestational diabetes. So what should you be doing these days? I encourage you to eat a good, healthy diet that includes fruits and vegetables, whole grain breads and cereals, lean meat. Because you are carrying twins, you need an extra 300 calories a day in the first trimester. I encourage you to take a prenatal vitamin every single day. Your provider is probably also going to want you to start taking a low dose or a baby aspirin. That is because you're at increased risk to develop preeclampsia later on in pregnancy. They may recommend you take extra folic acid, a little bit of extra iron, because again, you are at increased risk to become anemic. Make sure you're staying really well hydrated, at least 10 to 12 glasses of water every single day. If you are thirsty or if your urine is dark in color, you are dehydrated. I encourage you to stay as active as you possibly can while you're still able to stay active. And finally, get as much rest as you can. You are very tired because you are busy making 2 humans. Finally, I hope that you are writing down your questions in anticipation of your upcoming visit. In the meantime, if there are any questions that I can answer for you, please drop those in the comment section below. And while you're in that comment section, if you want to hit that like button, that would be fine with me.
If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.